Hello again, good morning. I hope you are well. Today we continue the series of interviews with the writers of the March 2024 edition of aviNews International Magazine. And today we are back with Dr. Edgar Oviedo. How are you, Dr. Edgar? Welcome again to aviNews International.
Hi, David. Nice to see you again.
Thank you very much. If you don't mind, I'll introduce you quickly for those who don't know you yet. Dr. Edgar Oviedo is a doctor in veterinary medicine from the University of Tolima in Colombia. He has a master's degree from the Universidad Estadual de Maringa in Brazil, and he has also a PhD from the University of Arkansas. Dr. Oviedo is a member of the American College of Poultry Veterinarians, and his expertise includes poultry nutrition, feeding, health, and management, among others. He works at Prestage Department Poultry Science in North Carolina State University. Doctor, it's a pleasure to have you here again. Thank you very much for sharing your vision of the article with all our people. After reading your article, I would like to start with a questions about the paper called Enterococcus infection, reduce hatchability and increase early mortality.
Correct.
Okay, in this article about Enterococcus infection in hatcheries, you mentioned that the average broiler hatchability rate has decreased in the United States in the past decade. What are the possible causes for this reduction?
Well, David, there has been a decline in hatchability reported since 2012, especially, let's say, the last 5 years, for multiple reasons. Not all are well elucidated, but and in some cases, not all reasons or factors may apply to all companies. However, hen mortality has increased, and the eggshell quality also tends to be an issue at the end of the flocks. Obtaining optimum fertility is difficult due to both male and female factors. And the early embryo mortality or livability has decreased. The livability has decreased, and then consequently, egg management requires more attention lately. The embryos also tend to die more during the last phase of incubation, and many hatcheries have observed increased egg contamination.
Okay, thank you, doctor, very much for your answer. Indeed, you mentioned eggs contamination. Several reports and scientific publications have recently indicated that some bacteria are often recovered from non-viable embryos in several countries. What are those main bacteria?
Yeah, David, the Enterococcus ecorum and the Escherichia coli are the most common bacteria found in non-viable embryos. However, the relative importance of each one of these bacteria is not clear yet. The other bacteria that also is found is Enterococcus fecalis, which is also associated with first week mortality in chickens and mortality in some embryos. The difficulty in their control is that all of these are commensal microbiota and common in the intestinal tract. And only under some circumstances is still well known, they become pathogenic.
Okay, thank you. According to your paper, specific research reports indicate that Enterococcus fecalis could penetrate the eggshell, evade immune barriers in the egg, and colonize systematically. Why can this bacterium do that so easily?
Well, Enterococcus in general are commensal bacteria, as we mentioned earlier, but some strains of Enterococcus ecorum and fecalis have developed genes of pathogenicity that allow them to evade the egg immune barriers and colonize them. They can actually penetrate the porus, so actually they are not affected by the different proteins that are in the cuticle that help to prevent this bacteria. And also the changes that these pathogenicity genes that they have modified their bacterial metabolism, allow them to proliferate in the membranes where normally the non-pathogenic strains couldn't survive. For example, the changes in metabolism can be observed by changes in the mannitol utilization. The pathogenic isolates in more than 95% of the cases cannot metabolize mannitol. In almost 40 to 60% of cases, pathogenic Enterococcus is associated with other bacteria such as E. coli, and probably even other bacteria that we don't know yet that help them to proliferate. So that those associations could make them even more pathogenic and able to invade and contaminate the embryos.
Okay, thank you, doctor. And it is true that Enterococcus fecalis is the most pathogenic of this bacteria. What seems to be the reason?
Well, yes, and in the compilation of diagnostics cases that I mentioned in this article, several researchers from University of Mississippi, North Carolina State, Arkansas, have observed that in samples from hatcheries, Enterococcus fecalis was isolated in 87 to 97% of the cases, making it probably the most pathogenic bacteria for embryos. This contrasts with other bacteria that are well known, like Salmonella or E. coli, that in many cases don't go or their prevalence is not higher than 5 to 15% of the cases.
Okay, thank you very much. Enterococcus secorum is another good commensal microorganism that cause considerable broiler industry losses due to sepsis and osteomyelitis. Could you please tell us more about it?
Yeah, David, as we had mentioned in previous articles of aviNews International, Enterococcus secorum is one of the pathogens that causes greater concern to the poultry industry. The pathogenic strains have modifications in capsular polysaccharides that make them more propense to infect, and actually they can cause embryo mortality at 12 days of age. However, Enterococcus secorum specifically is better known for infections in the free thoracic vertebra, which can reach almost 50% of the infected animals. So this is, as you mentioned, osteomyelitis is probably the most common lesion that these bacteria cause.
Okay. And this bacteria, Enterococcus secorum, could infect embryos during the ovovaccination or the hatching period?
Yes, one of the routes of infection that has been investigated in more detail is the in ovo vaccination. Once a few eggs are infected during this process, that is now very common, especially in the US, the embryos of chicks surrounding that infected egg can also become infected. So researchers at the University of Arkansas describe these routes of contamination, making it, of course, a good way to proliferate, since all eggs are moving through these in ovo vaccinations.
Okay, doctor, thank you. And this Enterococcus secorum bacteria, what kind of lesions cause?
Yeah, chickens infected in ovo with Enterococcus secorum will present mainly lesions in the heart, like focal heart necrosis. Still, other common lesions of systemic infection are observed, such as splenomegaly or hepatomegaly, so infection of the spleen and liver. But they are less common or concomitant to the systemic infection that they have.
Okay, thank you. And why is Enterococcus spp ubiquitous and universally present in all poultry categories?
Well, Enterococcus are normal inhabitants of the intestines of almost all animals, including in poultry. There are differences in the strains most commonly observed in poultry compared to other species, but at least from broiler breeders to chickens, almost they are the same commensal strains are present in the intestines. Interestingly, about 82% of the pathogenic strains observed in broilers are positive for the CPS0 gene, which codifies the polysaccharide capsular changes that classify these bacteria as pathogenic.
Okay, thank you very much. And the final question. Please tell us about the principal strategies and measures of control of Enterococcus.
Well, so far the control of Enterococcus is mainly related to biosecurity, cleanliness, sanitation in the hatchery, use of good disinfectants in the in ovo vaccination process and sanitation of this equipment, and keeping eggs that are not contaminated away from the hatchery as much as possible, avoiding floor eggs as much as possible. However, in some cases, with very pathogenic strains, these measurements don't seem to be effective, and the use, then people have tried the use of probiotics or symbiotics, and in some cases they help. Recently, there are other techniques used, like using even commensal non-pathogenic E. coli that has been evaluated successfully at North Carolina State University to cause competitive exclusion and prevent infections with pathogenic Enterococcus ecorum. However, other methods of controls are necessary. And for example, at this moment, the development of bacteriophages is under development, and it seems to have some promising results.
Okay, doctor, thank you very much for your article. And now it's clear to us that Enterococcus infection reduce hatchability and increase early mortality. As always, I appreciate your willingness for the interview, as well as for having written the article for this edition of the March 2024 magazine of aviNews International. This is the end of today's interview, and we will see each other in the next opportunity.
Thank you, and thank you everybody for watching this podcast.